Health Benefits Open Enrollment, May 1st through May 23rd, 2014. Highlights for July 1, 2014. Keep in mind that premiums and plan benefits may change, subject to final state budget approval. It's time to make your annual open enrollment decisions for your health benefits and flexible spending accounts. Only you know your family's health care needs, so think carefully before you decide. You can enroll, change, or keep the same health plan. There are also buy-up options you can purchase for an additional premium for COVA COVA Health Aware, and the COVA High Deductible Health Plan, or HDHP. You also have the choice during open enrollment of adding or removing eligible family members to your coverage. If you add a family member, you will need to submit proper documentation to your benefits office. There are two other open enrollment options. You may waive coverage, or you can enroll in a flexible spending account, or FSA. Remember that even if you have an FSA now, you must re-enroll to keep it for the new plan year. Let's talk about the health plans that you have available as a participant in the State Health Benefits Program. COVA and COVA HDHP are statewide plans administered by Anthem Blue Cross and Blue Shield and Delta Dental of Virginia. COVA Health Aware is also statewide, and Aetna administers all benefits. The Kaiser Permanente HMO is a regional plan offered primarily in Northern Virginia. The statewide TRICARE supplement coordinates with the federal TRICARE plan and is administered by ASI. In addition to the basic plans, there are several optional benefits offered by COVA COVA Health Aware, and COVA HDHP. As I mentioned earlier, you can purchase these optional buy-ups for an additional premium to enhance your coverage. For COVA Health Aware, you may purchase optional expanded dental or expanded dental and vision benefits. COVA HDHP has an expanded dental option administered by Delta Dental, and so does COVA. Other optional buy-ups for COVA are out-of-network and routine vision and hearing. Let's move on to an overview of each plan and any changes coming beginning July 1st. The first plans we'll discuss are COVA and COVA HDHP. For these plans, Anthem administers medical benefits, behavioral health, and an employee assistance program, or EAP. There are also prescription drug benefits, and Delta Dental partners with Anthem for dental benefits. Anthem has a wide-ranging network for coverage in the United States and abroad. Let's talk about a couple of changes coming July 1st. First, there is a change for COVA's prescription drug program. The second, third, and fourth drug tiers will increase $5 at your local retail pharmacy and $10 for home delivery or mail order, generally for maintenance medications. The second tier for lower-cost preferred brands will now be $30 at retail for up to a 34-day supply and $60 at home delivery for up to a 90-day supply. The third tier, or higher-cost brands, will increase to $45 at retail and $90 at mail. Finally, the fourth tier of high-cost specialty drugs will cost $55 at retail and $110 at home delivery. The second change we'll discuss involves behavioral health and applies to both COVA and COVA HDHP. Residential treatment centers are covered beginning July 1st for approved in-network behavioral health services. What is residential treatment? It's treatment at a 24-hour-a-day facility that requires a minimum of one physician visit per week. The copay for these services is $300, which is the same as the copay for inpatient treatment. Now we'll look at some of the plan features. The EAP for COVA and COVA HDHP provides up to 4 visits of free counseling for members and those living in their household. Included are mental health and workplace issues, parenting and child care, and other topics that apply to work and life balance. There is a dedicated website for state members at www.anthemeap.com. Delta Dental administers dental benefits for COVA and COVA HDHP. Members in these plans have 100% coverage for diagnostic and preventive services, such as routine exams and cleanings, as well as sealants and fluoride for children. These services are not subject to the deductible and annual maximum. Some frequency limitations apply. such as 2 cleanings in a plan year. Remember that if you and your family need anything other than routine dental work, you will need to purchase the expanded dental option during open enrollment. Expanded benefits include a $50 individual deductible, 80% coverage for such things as fillings and root canals, 50% coverage for services such as crowns and bridges, and 50% coverage for orthodontics. If you have questions, call Delta Dental Customer Service. You may purchase an optional buy-up for COVA to cover vision and hearing benefits. Remember that vision services related to medical conditions are covered in the basic plan. Covered vision services through the Blue View Vision Network include your annual routine eye exam, eyeglasses, contact lenses, frames, and discounts on eyewear accessories. The hearing portion of the buy-up includes a routine hearing exam, hearing aids, and other hearing aid-related services. The next plan we'll talk about is COVA Health Aware, a comprehensive, consumer-driven health plan administered by Aetna for all benefits. The COVA Health Aware Basic Plan includes coverage for all of the major health benefits provided by the Commonwealth, as well as a few extras such as a routine vision and hearing exam at no additional cost to the member. COVA Health Aware also includes a health reimbursement arrangement, or HRA, to help you pay your out-of-pocket costs. We'll talk more about the HRA in a few minutes. And for members who may need coverage beyond preventive dental and a routine vision exam, expanded benefits are available for an additional premium. There are 2 changes to the COVA Health Aware plan this year. As we mentioned earlier, our statewide plans will cover approved residential treatment centers for behavioral health needs. For COVA Health Aware, this benefit will be covered at 80%. Another piece of good news is that eligible COVA Health Aware plan members will have 2 additional Do Right incentive opportunities to increase the amount available in their HRAs. The Do Right incentive program will be explained in more detail later in the presentation. As we mentioned, the COVA Health Aware plan includes an account called a Health Reimbursement Arrangement, or HRA. Members can use these funds to pay for out-of-pocket medical, behavioral health, and pharmacy costs. And it's important to note that expenses paid by the HRA count toward the annual deductible and out-of-pocket maximum. The best part is that this all happens automatically when the claim is processed. If funds remain in the HRA at the end of the plan year, they roll over into the following plan year as long as the member stays in the plan. And Aetna helps you keep track of the HRA with online tools that can be accessed 24/7. You can find more information on these tools by calling the Aetna Concierge line or contacting your benefits administrator. The contact information is in Spotlight or the Retiree Open Enrollment booklet. At the beginning of the plan year, an individual employee or retiree will have a new $600 contribution in their HRA. If they cover a spouse, the amount will be $1,200 for the participant and their spouse. This will be in addition to any funds rolled over from the previous year. Although dependent children are not eligible for an additional contribution, funds from the HRA are used to help pay their out-of-pocket expenses. It's also important to note that the HRA is prorated for employees or retirees who enroll in COVA Health Aware after July 1, and members who have certain qualifying mid-year events during the plan year. More information about that can be found at www.covahealthaware.com. We've talked about the HRA, so let's take a look now at how the rest of the plan works. COVA Health Aware uses Aetna's comprehensive nationwide provider network. In-network preventive care is covered at 100%. For other covered services, you first meet an annual deductible. Then the plan pays 80% and you pay 20%. The plan continues to pay 80% until you reach your out-of-pocket max, at which point the plan pays 100% of expenses for the rest of the plan year. Again, funds used from the HRA also count toward the annual deductible and out-of-pocket limit. If you do some quick math, you can see that the initial HRA contribution plus the maximum do-right contribution equals half of the in-network deductible, depending on who is covered on the plan. Finally, Out-of-network coverage is provided as part of the standard plan, but your out-of-pocket costs are more. Enrolled members can get extra contributions to their HRA by doing things to improve their health, like getting an annual physical or tracking workouts online. These are called do-rights. An employee or retiree can earn an additional $50 per do-right for their HRA up to a total of $150. Their spouse can do the same, and if they both participate, together they can earn up to $300. Under the COVA Health Aware plan, it pays to be healthy. There are 2 new do-right healthy activities this year. You can have an annual routine vision exam and complete an online coaching module on the My Active Health portal, which we will talk about in a few minutes. COVA Health Aware's prescription drug benefits include something extra. The cost of your prescriptions count towards the overall annual deductible and the out-of-pocket maximum. So that means that the maximum you pay for your out-of-pocket expenses includes the cost of your prescription drugs. That may be important if you use costly medications. When you meet the deductible, you pay the Aetna contracted price for prescription drugs. Once the deductible is met, prescriptions are covered at 80% of the contracted amount. Participants can review drug costs before going to the pharmacy by using Aetna Navigator, their secure member website. If you need additional dental coverage beyond what is provided in the COVA Health Aware Basic Plan, you can purchase the Expanded Dental Optional Buy-Up. This option includes an individual deductible of $50. Once the deductible is met, the plan covers primary services like fillings, extractions, and root canals at 80%, and complex restorative services like crowns and dentures at 50%. There is a $2,000 plan year maximum. Expanded Dental also includes coverage for orthodontia at 50%, with a lifetime maximum of $2,000. If you purchase Expanded Dental, you can also buy Expanded Vision coverage. This includes an annual allowance towards the purchase of eyeglasses or contact lenses, and also access to discounts on other vision services. The Employee Assistance Program, called Aetna Resources for Living, can help you and members of your household resolve many types of personal and workplace-related issues. It includes up to 4 visits per incident at no cost. The EAP also provides legal and financial assistance to help with debt and credit counseling, budgeting, taxes, or planning for life expenses like college or retirement. This confidential service is available online and telephonically 24 hours a day, 7 days a week. The 3 plans we have just talked about, COVA Care, COVA Health Aware, and COVA HDHP, have something in common for you as a member. It's the My Active Health program for helping you improve your health. This program provides coaching services and partners with Anthem and Aetna to deliver services that promote healthy lifestyles and help you manage chronic conditions. The My Active Health program includes a web portal that is customized for each participant, spouse, and dependents. All eligible adult members may access the portal, complete their individual health assessment, and schedule a biometric screening. Plus, you receive enhanced online coaching and web tools for tracking your health, like interactive trackers and games. My Active Health also includes extra programs at no cost. Healthy Lifestyles provides lifestyle coaching on smoking cessation, weight management, stress management, nutrition, and exercise. The Healthy Insights program helps you manage chronic conditions like heart disease or diabetes. Healthy Beginnings helps expectant mothers be healthier so they will deliver healthier babies. The Healthy Insights program I just mentioned has some special incentives attached for members of COVA Care or COVA Health Aware. It provides diabetes drugs and certain supplies at no cost when you meet the requirements. New programs for July 1 on hypertension and COPD and asthma will also provide free prescription drugs when the requirements are satisfied. Incentives are also available in the bariatric surgery coaching and Healthy Beginnings programs. Now let's move on to the Commonwealth's regional plan offering, the Kaiser Permanente HMO. This plan is offered primarily in Northern Virginia and the Fredericksburg area and also in other state zip codes. You can enroll in Kaiser if you live or work within the service area. If you have questions about eligibility for the Kaiser plan, contact Kaiser directly. The new feature for Kaiser this year is pediatric vision eyewear for children up to age 19. This benefit is at no cost to members and includes 1 pair of frames per year from a select group and certain single vision or bifocal lenses. As an alternative, you can have up to a 3-month supply of contact lenses from a selected list. The final plan we will highlight is the TRICARE supplement administered by ASI. This plan coordinates with federal TRICARE benefits. You and your dependents may participate in the TRICARE supplement if you are eligible for the state health benefits program and TRICARE as a military retiree. One note, you cannot be eligible for Medicare. If you enroll, you are responsible for paying 100% of the monthly premium, and active employees pay with pre-tax dollars through payroll deduction. Speaking of premiums, the Premium Rewards Program will be offered to COVA Care and COVA Health Aware participants and spouses again for the new plan year. Employees, retirees, and/or their enrolled spouses are eligible. As an employee, retiree, or spouse, you can save $17 a month, and together, participants and spouses can save $34 a month. What happens with your premium reward depends on your status. So first, if you already have a premium reward included in your paycheck, your reward will continue through June 30th, 2015. Just be sure that you remain in COVA Care or COVA Health Aware and that you do not opt out of the My Active Health program. Other than that, no actions are required. And new this year, you can confirm your reward status on Employee Direct on the Health Benefits Enrollment and Information section bulletin board. Select View Current Health Benefits Profile, then look at Section 3, Healthcare Coverage Election for Reward Earned. If you want to earn a premium reward, you need to take action by the following deadlines depending on your enrollment category, so listen carefully. If you enrolled in COVA Care or COVA Health Aware from July 1st, 2013 through March 1st, 2014, you must complete and submit a health assessment and biometric screening by May 31st, 2014. Those who enroll in COVA Care or COVA Health Aware from April 1st through July 1st, 2014 must submit a health assessment and biometric screening by August 31st, 2014. That includes those who make open enrollment elections for July 1. You can register to take your health assessment and arrange a biometric screening on the My Active Health portal or by telephone as shown here. See your spotlight for more information. Let's move on to a way you can save money before taxes. The Flexible Spending Account, or FSA, is available to all eligible state employees. It is not available to retirees. An FSA allows you to set aside funds from your paycheck, pre-tax, to cover eligible expenses. On average, an FSA saves you about $30 on every $100 spent on things you may already be paying for out of pocket, like co-pays, deductibles, and coinsurance. It's important to plan FSA spending carefully because you can't carry over funds from year to year. The Health FSA lets you set aside up to $2,500 and pre-tax dollars per year to pay for eligible health expenses. You'll receive a convenient benefit card that you can use instead of paying out of pocket at the point of service. The Dependent Care FSA lets you set aside up to $5,000 in pre-tax dollars per year to pay for dependent daycare expenses. New participants can go to www.anthem.com/COVA to learn more about the FSA. You can use the online calculators to help estimate how much money to put aside in your account. Starting July 1, you can register on the FSA site and start your online account. Current participants who want to continue their FSA need to re-enroll each year. Here's what has changed for the FSA this year. FSA claims must be filed within 3 months after your coverage period ends. This includes any documentation required to validate an outstanding FSA card transaction. For details on health and dependent care FSAs, see the new 2014 FSA Sourcebook available from your benefits administrator. There are several things to remember about an FSA. All participants need to register online to get the most from their account. You'll be able to view account balances, account activity statements, and direct deposit activity. Remember to enroll each plan year if you want to participate in an account. If you enroll in COVA Health Aware, the HRA pays first before the FSA. See Spotlight for website and contact information. Guess who's back this year? Alex is your online interactive assistant. He can counsel you on what plan may be the most cost-effective for you. So visit www.alexforcova.com. But remember, the final decision is yours to make. Here's where to get more information in your Spotlight or Retiree Open Enrollment booklet at www.dhrm.virginia.gov from your agency's benefits administrator, or you can contact the plans. Make your election by visiting Employee Direct. Log in and select Health Benefits Enrollment and Information, or submit an enrollment form to your agency's benefits office. Your final answer is due May 23rd. Be sure you don't wait until the last minute. It's your call. Consider the healthcare needs you and your family have. Then choose your health coverage. If you decide to enroll in COVA Care or COVA Health Aware, consider earning a premium reward. Finally, employees, don't forget the advantages of enrolling in a flexible spending account.